All right. Hello, everyone. Welcome to our third Concentric Value of Vaccination webinar series. This one is about the role of resilience. My name is Elana Kieffer Blass, and I am the Director of Strategic Alliances at the Gerontological Society of America. I want to thank all of you for joining us this afternoon. And for those of you that have been here for the previous two webinars, we particularly appreciate your continued commitment to this topic, and welcome to any new people as well. Next slide, please. So this would not be a Zoom webinar without some housekeeping items. So please, if you have questions, we will of course have time at the end for them. And so we ask that you type them into the Q&A box. We really welcome your questions throughout, and then we will address them towards the end. And our program is being recorded today and will be available on demand on GSA Enrich, which is our learning management system, very shortly. We will also send out the slides and any relevant resources as well in the coming days. And we, of course, value your feedback. This is the halfway mark of the webinar series, so we would love to hear your ideas for future topics and ways that we can improve the webinar series. So we ask that you fill out the very short evaluation at the end of this webinar today. Next slide, please. So as I mentioned, I'm Elana and I work at GSA. I focus on, of course, the topic area of adult vaccines and immunization, as well as financial security, opioid safety, and age tech. And I am very happy to be joined by our featured speaker today, Dr. Barbara Resnick, who is a professor in the Department of Organizational Systems and Adult Health at the University of Maryland School of Nursing. She is also their Associate Dean of Research and holds the Sonia Zaporkin-Gershowitz Chair in Gerontology at the Maryland School of Nursing as well. And most relevant for us today, she is a former president of GSA. So you will be hearing from her and her topic of resilience shortly. Next slide. So at GSA, and you can press twice actually, thank you. So at GSA, we have developed a platform called the Concentric Value of Vaccination as We Age. And we encourage you to check out our website, and you can pick up your phones right now and go to our CVV webpage. You'll see on that page that we have a host of resources. One of them is actually a full report about CVV, and that focuses on the intersecting health, economic, and societal benefits of adult vaccines and focusing on older adults and the aging process. We also have highlights around vaccinology research and how vaccines actually work. We also developed an executive summary, which you can see here on the other side, and that is a two-sided one-pager that really, in a pithy way, talks about the intersecting health, economic, and societal benefits of vaccines. All of our work here, we want to get out into the public. So we hope that you will check out our products and research, share them with your friends, your family, your coworkers, and your neighbors. And we're talking specifically today highlighting the societal benefits. So we really want this to have an impact on your society and society as a whole. And so we made this executive summary so that you can have something concrete and quick to read and also to share. Next slide. So this, as I mentioned, this is the third in our series. So very briefly, just want to review the first two that we completed. The first one was focusing on the health benefits of vaccines, and we talked about basically how a vaccine works. And we talked about some burgeoning research about specifically the shingles vaccine and how it has been shown to slow biological aging. And you can check out that research. It's in one of our journals, the Journals of Gerontology Series A. And then our second webinar was about the economic benefits of vaccines. And we highlighted a really illuminating report about the economic benefits of the flu vaccine. And I encourage you to check that out as well. The numbers are quite staggering. Next slide. So the way that we kind of frame this, as I mentioned, is with different benefits. So I imagine many of you on this call are familiar with the health benefits of vaccines and specifically adult vaccines. It helps to prevent infectious diseases, increase one's lifespan, keep you out of the hospital, and preserve functional independence. Next slide, please. But then there are also some kind of lesser known and lesser discussed economic benefits. So just to give you some numbers to this, adult vaccination programs can yield as high a return as 19 times the original investment through reduced illness, fewer hospitalizations, and greater labor force stability. And among older adults specifically, for vaccine preventable diseases, which are influenza, pneumococcal disease, shingles, and pertussis, otherwise known as whooping cough, they resulted in the last year in nearly $27 billion with a B in total annual healthcare costs among adults in the US that were age 50 and older. And of those costs, 80% of those costs were due to adults that were not vaccinated. So, in addition to the cost savings of the health aspects, such as reduced medical care and reduced hospitalizations, vaccines also help improve workplace performance by reducing absenteeism in the workplace and improving overall employee health. And in addition, 20% of adults in the US care for a family member with an illness or disability, and many of them also care for children, what's commonly known as the sandwich generation. So if that one person who is the caregiver is sick, there is a cascading effect on their loved ones, whether or not those loved ones also are sick with a vaccine preventable disease. Next slide. And then there are the societal benefits. Next slide, please. So, vaccines impact, of course, the individual, but they also they also very much impact the circles around the individual. So they really do, as Dr. Resnick will speak much more about, strengthen communities and especially community resilience and helping reduce the transmission of disease, again, in one's home, in one's community, and in one's society. Also, it helps to make sure if you're not sick with a vaccine preventable disease, then you will be able to go to work, to be able to take care of those that rely on you for caregiving, and to be able to be a participating member of your community. There are also many people, for a variety of reasons, that cannot be vaccinated. And so the more that are vaccinated, the more that helps protect those populations. And we heard a lot, especially during the pandemic, about this concept of herd immunity or community immunity. And that is really, again, kind of thinking about the more people that are vaccinated, the more that positively impacts and protects those who are immunocompromised, older adults who might have a weakened immune system, and many other types of people that are at risk. Next slide, please. And the healthier community and society we have, the better it is for individuals and for all of us as a whole. And so it, of course, can help older adults, and again, really all people, all of us are aging, maintain our independence and stay out of any type of institutional care for as long as possible or completely. And also, again, just kind of enables, kind of reinforces that socialization and that social fabric that we all rely on really to live our everyday lives. And as Dr. Resnick will talk about, also really, again, supports both individual and societal resilience. And so with that, I'm going to turn it over to Dr. Resnick to give us her talk.
So thank you. And I'm just sitting here thinking I raised the issue of resilience a little bit jokingly because I do feel today that with regard to immunizations, whether it's at the individual or community level, we all need to be resilient for reasons I'm sure I don't need to share with any of you. I'm going to spend some time at the beginning here to really pound in what the definition of resilience is, what it really means, and then we'll take it a little bit more to the community level. You can see it's going to be lots of cartoons to remind you, but life doesn't get any easier or more forgiving. We get stronger and more resilient, which is very true of older adults, particularly the survivors. They get more resilient with time. Next slide. So immunization resilience refers to immunization systems that are able to withstand major shocks and disruptions to quickly adapt to changing circumstances in order to continue to maintain high vaccine uptake and acceptance. Very true of our worlds today. It's more than increasing vaccine coverage, but it's really about growing and maintaining high coverage over time across all vaccines and age groups. I'm not going to talk about pediatrics today. And having communities that strongly support routine immunizations. You can see the Wicked Witch there says it doesn't work anymore. You can't get her. She had her shots. Next slide. So to really understand community resilience, I think, as I said, it helps to understand individual resilience. Resilience has been defined in many ways and is considered both a process and a personality trait. So some people are just resilient. There's a genetic component, but there's also a process in that you can learn to be resilient. Resilience refers to an individual's capacity to make a psychosocial comeback in adversity. We don't think about resilience, or you should not think about resilience until somebody is challenged. Being resilient indicates that the individual has the ability to adapt in the face of some challenge, whether it's tragedy, trauma, adversity, hardship, significant life stressors, or all the negative things they're hearing about vaccines. With regard to older adults, resilience is described as the ability to achieve, retain, or regain a level of physical or emotional health after illness or loss. Resilient individuals tend to manifest adaptive behavior, and it often is the way that they're going to be less likely to succumb to an illness. Getting immunized is a really important resilient behavior for older adults, for any adults. Next slide. Resilience is the process of negotiating, managing, and adapting to significant resources of stress. Significant sources of stress or trauma. Again, I can't stress enough that resilience doesn't come into play until we're challenged by something. Hip fracture, flu, a heart attack, anything acute, or it could be a loss of finances, a loss of a home, a loss of a dog, whatever that challenge is. Assets and resources within the individual, their life and environment then facilitate their ability to adapt and bounce back in the face of adversity. Across the life course, resilience may vary. And as I said, what tends to happen with older adults is they've learned over time to be resilient, at least the survivors. What defines us is how well we rise after falling. Next slide. Resilience, as I said, is a process, and it's a dynamic process that's influenced by whatever happens in life. And I know if you've ever cared for an older adult who's really not had any medical problems throughout their life, kind of been pretty healthy, well, when aging hits and things change, they get pretty freaked out about what we might refer to as quite normal age changes. Some vision changes at 40. You adapt, you get glasses if you're resilient, or you freak out. Bowel changes with age that may be really normal changes. You adapt or you freak out. A little pain and stiffness in the morning. Somebody the other day in her 40s was asking me, the daughter of one of my patients was asking, what could we do to make her morning stiffness go away? Again, adapting to those changes, being resilient, adjusting, and more importantly, as we see over there by Tigger, life is not about how fast you run or how high you climb, but how well you bounce and how well you bounce back in the face of those challenges. Next slide. So, is resilience relevant? Well, I think it is. I think it's the key to successful aging. Older women who have successfully recovered from orthopedic or other stressful events describe themselves as resilient. Sometimes they'll use the word determined, and they tend to have better function, mood, quality of life than those who are less resilient. Resilience has also been associated with adjustments following the diagnosis of dementia. Again, some people rise, cope, make the best of it, and others fall apart. There's been resilience seen after widowhood, after the adjustment associated to, as I said, the stressors of aging, the normal changes that occur, as well as resilience with regard to communicable diseases such as COVID or pneumonia. Next slide. Older adults that have sustained multiple losses over their lifetime may have accrued positive experiences and learned resilience. Resilience are evidenced by demonstrating behaviors known to assure recovery. And that's how some people measure resilience. So your resilience, or you are considered resilient if you recover from a hip fracture, or in fact, that might just be lucky. To me, the resilient person is the one that works really hard in therapy and gets better. So there's different ways to look at resilience, and we'll talk more about that in measurement. Resilience, specifically personality characteristics, are associated with resilience and can facilitate or impede adaptive responses, like getting immunized, engaging in regular exercise, or reaching out to social supports. Next slide. Just a little reminder, and when we talk about ways to strengthen resilience, maintaining strong social connections is one really important way to do that. And I think we're hearing and seeing more and more about this, even in the lay literature, the value of social support and engagement. Next slide. So what do resilient individuals look like? Well, resilient individuals tend to manifest adaptive behavior, especially with regard to social functioning, morale, and somatic health. And take a minute and think about yourself. How do you respond in the face of a challenge, whether it's a physical challenge, an economic challenge, a work-related challenge? How do you respond? Resilient individuals with regard to illness are less likely to succumb to illness or disability. And forgive my somewhat sexist cartoon there, but how does a woman respond to a cold versus a man? Next slide. So the ultimate resilience is the ability to not only spring back or bounce back to where you started, but to actually spring forward and grow through the experience. An example would be experiencing COVID and then saying, aha, maybe I should get immunized in the future. And we saw that with many people who never got immunized for anything, but when it came to COVID, they got immunized. I had a patient once every year with regard to flu, she would tell me, no, no, not getting the flu shot because the flu shot gave her arthritis. Every year I tried to change that little myth. But when COVID came around, she was like first in line to get the COVID vaccine. Next slide. I really like to look at resilience using the resilience model. So when challenged by some type of experience or illness, the individual has the choice to use internal protective factors such as self-reliance, self-efficacy, self-esteem, as well as psychological and physical health, and external protective factors like the social supports we talked about, to restore balance to life and to grow through the experience. When we're challenged, we all have that choice. You can crawl into bed and pull the covers over your head, or you can be resilient. And this is referred to as resilient reintegration, or else you can reintegrate following some type of challenge or disruption by returning back to prior functioning, at least getting back to baseline. The person who sort of has a hip fracture gets back to kind of their basic ADLs, but doesn't take it a step further and say, wow, I learned lots of things in rehab and I should increase my physical activity. Alternatively, you can reintegrate with a sense of loss and disappointment. Oh, poor me, I had a hip fracture. I'm going to sit in a wheelchair now. Or you can become really dysfunctional and unable to cope following the disruptive period. Next slide. This is just a pictorial of what I'm referring to. You have a stressor, it disrupts your homeostasis, and you have a choice to do something. May be conscious, may not be conscious, maybe your personality, you're Mr. Negative to begin with, and it's all, the glass isn't even half full. But you have a choice. You can have resilient reintegration and really grow through the experience. You can return to your baseline. You can feel loss and disappointment, or you can become really dysfunctional. Next slide. I think it's also important to remember there's many types of resilience. There's health resilience, and I'm not going to read all these definitions to you, but just to give you a sense of how important it is to think about resilience in specific areas. There can also be psychological resilience or emotional resilience, dispositional resilience, physiological resilience. Some very interesting things, for example, about some people who just don't seem to get things like the flu, upper respiratory infections, because genetically they are able to fight these off. And then there's physical resilience, the ability to recover or optimize function in the face of age-related losses or disease. And there's many other kinds, as I said. There's economic resilience. Some people would fall apart if they lose money financially and couldn't figure out what to do, whereas others might say, wow, opportunity, I'm going to start over. The same with a work situation. Next slide. These are all the characteristics of resilience. Positive interpersonal relationships, strong self-efficacy, and that might be self-efficacy around the area of resilience you're looking at. So self-efficacy for physical activity, for example. Positive self-esteem, a sense of purpose, spirituality, the ability to use humor, creativity, acceptance of change, maintaining a positive attitude, and optimism is highly associated with resilience, ability to identify and utilize resources, ability to ask for help. That's something that I personally have had to learn a lot about being resilient and recognizing there's times you need to ask for help. Particularly when you're my height, need to reach something, for example, a very easy situation. But for some people, it's really hard to ask for help, and that's being resilient. Self-determination, optimism, as I said, seeing joy in each day or finding the joy in each day, particularly in what might be life-threatening health situations. Having grit, and many people describe this as having grit or determination, maintaining hope, adapting coping styles, finding meaning in things, prior experiences with hardship and recognizing them, highlighting them, so you remember that you did it before, you can do it again. Self-acceptance, you are what you are, and self-care. And I really like this cartoon because this woman makes me think about being resilient. And then I blew out the candles and my dang old teeth popped out and landed on the cake. Ha ha ha. She couldn't care less. She is just personally resilient. Everybody else's problem and more cake for her. Next slide. These are just the 5 C's we tend to think about with individual resilience: control over it, commitment to recovering or responding, that social connection, calmness, and care for self. Next slide. I'd like to highlight the differences between motivation and resilience. Resilience, as I said, unlike motivation, relies on the individual experiencing a challenge, some type of adversity. These challenges can be developmental, normal aging, vision, physical changes. They could be social or economic. They could be loss of employment, loss of a spouse, a move to a new setting of care. Motivation is not dependent on an adverse event or challenge, but it's a necessary component for all activity. So we need motivation to be resilient. And some of the ways that we motivate people help them to become resilient, but they're really 2 different things. It's only when an activity does not occur that questions are raised about motivation. Conversely, resilience is required when the individual is faced with bathing and dressing challenges, say following a wrist fracture. Next slide. It's actually believed that everybody has the innate ability to be resilient, but they make choices. And the choices may or may not result in resilience. And I always joke, sometimes something happens, even think about this, you get a bad score on a grant or a paper rejection. And sometimes I feel like, you know what, you need a day or two to wallow, feel sorry for yourself, whatever it is. And then you pull from your toes and you get resilience and you say, darn it, I'm going to revise and resubmit. When faced with a challenge, the individual must summon the motivation in the face of adversity to be resilient. If you're not motivated to be resilient, you may not even return to homeostasis. And again, you may go down the tubes. When you're motivated to engage in the behaviors necessary to be resilient, you're more likely to experience that resilient reintegration and end up stronger and grow from the experience. Next slide. So there's many ways we evaluate resilience, and some of this is, as I said, based on what we see the individual do. So if they recover from that hip fracture, they're considered to be resilient. Alternatively, we can look at some of the resilient characteristics and determine somebody is resilient. Next slide. I think it's really helpful to evaluate resilience. And we're going to go through a bunch of measures, which I'm just going to click through the slides. I put them there so that you have them to get a sense of the many different measures. Many of the items are similar across all these measures, and there's some description of them. Life is like riding a bicycle. In order to keep your balance, you must keep moving. It's important to see if that person can stay on the bike, if they are resilient. And if they're not, then there's interventions we want to use specifically with that individual. Next slide. I'm going to just have you flip through these slides. There are different measures of resilience. So go ahead, next slide. Next slide. You can see a dispositional resilience scale, a brief scale. Keep going. Keep going. This is the physical resilience scale. Next slide. Very common 14 item, the Hardy-Gill resiliency tool. And just in review, all the measures basically look at the assets of the person and resources for resilience. Next slide. Some interventions to strengthen resilience include developing those dispositional attributes, vigor, optimism, and physical robustness, improving socialization practices, and then strengthening self-efficacy, self-esteem, and motivation through interpersonal interactions. And usually that's verbal encouragement, role modeling, get rid of unpleasant sensations around a behavior, and getting somebody just to do it and letting them know how successful they were. These areas are not mutually exclusive. You can do all three together. Next slide. So interventions for resilience at the individual and community level are multifaceted approaches. It also involves risk-oriented strategies that assure older adults are not exposed to experiences that might decrease resilience. Some of that's the social media that we hear, particularly with regard to immunizations, environmental interventions, access to immunizations, really important there. And then social networking systems that disseminate opportunities for things that help people be resilient. And again, this could be positive social media around immunizations. Next slide. So the immunization resilience focus, as I said, refers to immunization systems that are able to withstand major shocks and disruptions, to quickly adapt to the changing circumstances, to maintain high vaccine intake or uptake. It's more than just increasing vaccine coverage, but again, growing that. And I love this cartoon as well, but if everybody else gets a flu shot, I won't need one because there won't be anybody to catch it from. Next slide. So some challenges to immunization resilience. Individuals and communities forget about the impact of disease that is prevented by immunizations. The loss of value of the vaccine leads to a lower demand, and the impact of the health system and their ability or inability to respond to crisis-related disease and less effective communication strategies. Next slide. This is just the matrix of vaccine demand resilience. It really just looks at people's attitudes and beliefs, their behaviors, and the outcomes of vaccine status. Next slide. The purpose of this matrix is just to help us remember to think about all of these different factors and how they influence vaccine and vaccine uptake in today's world. Next slide. So the immunization agenda of 2030 from the World Health Assembly in 2020 was a goal for all to be immunized. Individuals need to accept, seek, and become vaccinated, and building immunization reliance depends on assuring that all three components of that matrix occur. And when there's not sufficient availability, it's dependent on individuals to increase demand through the three components. So again, when there's not opportunities for vaccines, or there's a push to decrease vaccine opportunities, it's our responsibility to push for it. Like diseases, fear and misinformation spread easily to those who aren't vaccinated against them. If only there was such a vaccine. Next slide. So resilience is really accepting your new reality, even if it's less good than the one you had before. You can fight it. You can do nothing but scream about what you've lost, or you can accept that and try to put together something that's good. A final word on resilience: the patient who got RSV, COVID, pneumonia, or the flu has the opportunity to bounce back and get immunized and grow with the experience. That's an opportunity to build resilience. I knew it was too good to be true when my horoscope said I was going to get poked by a younger man. Next slide. I think we have a few minutes to answer any questions.
We do. Thank you so much, Barb. There's a lot there to process, and I have a lot of questions related to resilience in general, but I also want to make sure to ask you about them related to adult vaccines. And I see from our audience it's similar. So we'll kind of go back and forth with those. And I also absolutely love all of those cartoons and want to put some of them on my refrigerator. So thank you for that. And I also want to thank our sponsors who have made this webinar series possible, as well as all of the reports that we have been able to share and disseminate in the world, including CSL Seqirus, GSK, Johnson & Johnson, Moderna, Pfizer, and Sanofi. So thank you to all of those companies for that. And now let's get into some questions. So the first one, Barb, is given our current political environment and many different conflicting messages that a lot of people are receiving about vaccine these days, I think we all need to practice some resilience on all sides of the aisle. So kind of just given all of that, what can we do to specifically motivate older adults to continue to get their immunizations?
So I think the most important thing would be to strengthen their vaccine resilience. So how do you do that? You do that through building their self-efficacy around vaccines. So verbally encouraging, which is teaching, but it's also that opportunity that we all have in every encounter with, if you're a healthcare provider with a patient, if you're a social worker with any interaction you might be doing, to remind them of the value of getting vaccinated, encouraging them to do so, and remembering if they say no once, that's only a no once, and you can never let it go. You have to be totally obnoxious about this because it says you care about them. You care
Mm,
about them enough to keep asking. That will help build their resilience, hopefully. It may tear down your resilience. You may become very tired because it is hard to be a cheerleader, but you want to do those things. And then also role modeling, sharing how you got immunized, how their neighbor got immunized, or the patient before them, or their roommate if they're in an institution. So it's that constant building, and also using certainly social supports. And also with older adults, I think the altruism around immunizations is also a helpful technique to build their resilience.
say that last part again.
Altruism and reminding them if they get immunized, it's going to help their own
Yes.
families, the caregivers, everybody.
Yes, absolutely, which kind of goes to our societal benefits piece.
Exactly.
And I've also heard that conversations between healthcare providers and patients of all ages, when patients do express concern or questions about vaccines and about vaccine risks, that it's important to listen to those questions and to really discuss them and not just to say, oh no, you'll be fine. This is totally safe. Can you just talk a little bit about that and perhaps from personal experience as a provider?
Oh, yeah. Well, when it comes to, truthfully, the area of motivation, it's always finding out, you know, I say, act like a toddler, but why? But why? Tell me why you don't want to get immunized.
Mhm.
And same with, I do a lot of exercise interventions and getting people to exercise. And, you can sometimes tell when it's really an excuse. There's a difference between an excuse and a real reason. And sometimes we have to keep digging. So I didn't have time to get immunized, doesn't usually cut it for me. Um, Cost doesn't cut it. Give me the real reason. But it is listening and letting them talk and not blowing off the fact that they say no. And then once you hear that reason, it's working through it. Now, it still may be a no at the end, but maybe you'll break that ice over time.
Yeah, absolutely. Um, let's see, how do most people, do you think, learn to be resilient? Because it is a skill, we're not all born with it. And do you think it's often through kind of observing our parents growing up? Is it through our friends or coworkers? Is it a personal decision? And I know there's not one answer, but just kind of even anecdotally or through your research, what have you found in that way?
So a couple of things. First of all, I think it is in part resilience. I'm sorry, is in part personality.
Yeah.
So there is a genetic component. And then it also is how you are brought up. Um, I always joke, I had a father who always said he was a Russian immigrant, but you could never say, I can't. You had to say, I'll try. And the other way that I think people really learn resilience is by experiencing challenges over time and for any number of reasons overcoming them. So it is accrued. And that's why, I mean, most older adults, the hardest thing with measuring resilience in older adults is they all score so high. And we have to keep, I've made many resilient measures, and you have to keep adding more challenging items because these folks are so resilient.
Hmm. Yeah. Yep. I really liked the reference you had early on in your presentation about the importance of social connection. And we talk about that at GSA in many different ways. And obviously the research on social isolation and loneliness and all of that is for, again, for all ages and particularly for older adults, is so key. So my question to you is, how can we leverage the importance of social connection to encourage or motivate adult immunization?
Well, I think, first of all, with regard to social connection, you have to be resilient to be willing to socially engage. For some people, it's a lot easier than others. Some are very uncomfortable about picking up the phone and calling somebody
Yeah.
and saying, you know, go out to dinner, whatever, go get vaccinated together. And
Yeah.
we see this I do a lot of vaccine work in senior housing, for example. And we see, one resident will go up and get their neighbor to come down. And that's a really helpful way to encourage the social component. I think really where the social comes out with immunizations is also that protection of
Yeah.
your friends and neighbors.
Yep. Absolutely. Absolutely. So, relatedly, we hear a lot, especially in the vaccine space, and in the public health space in general, about trusted messengers. And it sounds like what you're saying is that kind of friends and peers can actually play a significant role in motivating people to get vaccines. So I'm just curious if you can talk a little bit more about that. And have you found, again, just kind of in your research or in your work, are adult children often besides older adults themselves deciding to, but let's say there's other people involved in one's care. Is it typically an adult child? Is it typically the healthcare provider directly? What have you found to be kind of another important person in that person's patient's life to help make that decision about getting vaccinated?
I think that's very individual. It can be any one of those people. Some people trust their friends. Some people, unfortunately, trust what they hear on the news.
Yeah.
Some will listen to what a child says. We in geriatrics often deal with people with cognitive impairment. And so it is the child that we have to, I'm going to say, work through. I won't use the word convince, but work through to explain the particular value of mom getting immunized. It may be different for them if they're 40 years old and healthy. It's a different story than it is for mom.
Yeah.
So it really just depends. Some older adults, as I said, don't have a choice because
Right.
somebody else is making that choice for them.
Right. Right. And then thinking about resilience more broadly, so you shared a number of different resilience measures. And can you just kind of talk about, kind of broadly speaking, maybe like what those different measurements have in common? How do we just kind of broadly measure resilience? And just kind of on a personal level, how do we know if we are becoming more resilient, if we're really working at that?
Mhm. So some of the things, the items within the measures are very similar. Um, it's more around like, do you tend to see the world with a glass full to overflowing versus half full?
Yep.
You know, think about how you have responded in the past. Do you tend to um, pull from your toes and work through issues? Do you tend to grow from an experience or fall apart? And if you had to describe yourself, are you an optimist or a pessimist? Are you likely to be able to ask for help appropriately? Now, some people ask for help too much. They,
Mm,
let's put it this way, they use the system, but appropriately asking for help when it's needed. And it's needed to help you grow. So there's some personality ways to think about resilience. The ability to find joy in each day.
yeah,
Do you do that when you wake up? Do
yeah,
you think about that? Is a really important component to being resilient. And that, to me, is one of the things you can force yourself to do.
yeah,
You can take a moment and say, I'm going to just fall apart today, or I'm going to find joy in walking around the block and listening to the birds, looking at the sunset. I mean, whatever that small moment is, that's all it takes. And that will help you be resilient.
yep. I
But if you can't
totally
do
think.
that and you'd rather just wallow in it, have at it
Yep, yep, that's your
and
choice.
suffer.
Yep, yeah. And I think the last question is that one of the audience members would love to hear about any intergenerational strategies for building resilience and championing, it's a hard word, championing vaccination, particularly for communities that might have non-traditional family structures.
Yeah, so I'm not sure what would be non traditional necessarily or what they're thinking of. But I think another thing that's important with resilience is using humor.
Yeah,
We talked about finding joy, but maybe there would be a way among an intergenerational group to do it together and to talk about why it's so important, the benefit at each level. If you get immunized, you won't miss any school and you'll get that reward at the end of the year for not missing any days of school. And if grandma does get immunized, she's going to be protected from having a sick day, for maybe having some very bad things happen to her and having a stroke or a heart attack after um, getting the flu or pneumonia. So I think just making it a really fun group activity. Um, we're going to go to the pharmacy, we're all going to get immunized, and then we're going to go out and get an ice cream cone.
yep, yep, absolutely. And I think the more intergenerational activities and connections we can do, the better for all of society.
Right.
So Stephanie, if you could just share the slide once again, just that last slide with the QR code. So we just encourage you all to check out our CVV webpage. Please, we want you to take our materials, share them with everyone that you know. Please fill out the very short feedback form. We will have another webinar in about 2 months on this kind of continuous theme. And Dr. Resnick, I just want to thank you so much for sharing your wisdom and your research and your work, and your passion for it really comes through the Zoom screen. So thank you, and thank you to all of you for joining us today.
Thank you.